Welcome to Living with Sjogrens. I'm Sjogren's sTrouper, Vicky. And today I'm coming to you just to share with you what it is like to be inundated with chronic illness, specifically autoimmune for me. So often the symptoms are so overlapping, and the self-care takes a lot of energy. Every day is different. Some are worse, some are better. Keeping track of all the medications, when they have to be refilled, when I'm going to be out of a supplement, all the doctor's appointments, what time they are. There are often several different types of health providers involved in our care, like a primary care provider, a rheumatologist, gastroenterologist, maybe urologist for the bladder. Did I say neurologist? There's eye doctors, mental health providers. There's a lot to managing. And those of you who have been able to keep track of all of your appointments, kudos to you. It's so important to have a system down. But when you're feeling poorly, like your symptoms are just overwhelming, and you may not even be going through a flare, but just coping with a new low of baseline type symptoms or cognitive functioning. And it really overwhelms a person and makes it really hard to stay positive. We start feeling like there's no hope for the future. Here I am, 63, almost 64, and I still have aspirations. I want to share with you what I'm doing and what I'm working on to help myself cope, because it really is an absolute full-time job to manage this. I feel like the more people that I watch their stories, or I hear their stories, or I follow along with them, the more encouraged I am, because I hear about things that they're doing that I hadn't done before. And my therapy sessions are really helping me tremendously. So I have one thing to share today about something I've been learning and working on in therapy, and that is self-check-ins. Checking in with myself. You know, first it was a planned thing, and I set the timer on my phone to do 2 or 3 times a day, because I found myself perseverating on certain things. Our body and this disease process is always fluctuating. And what we might need one day can change between one day and the next. So these self-check-ins have been really helpful to me. And how it goes is I ask myself, what am I thinking right now in this moment? What am I feeling? And taking those two things into consideration, I say, okay, what is it I need? What does my spirit need? What does my body need? What does my mind need? What to who Vicky is? What does she need right now in this moment? And then I say, is it something I need from someone else? Or is it something that I can give myself? Sometimes it's both. And it really has taken work for me to learn how to do that. And sometimes it's really a struggle. And I have learned that when there's a strong need, or there's strong emotions, strong thoughts and strong emotions, that there is a strong need. And until I can work that out with myself, I have resolved to stay silent about what I'm frustrated about or upset about, because I don't want those thoughts and those emotions to come pouring out onto somebody else as if they're to blame for it all. Not saying I'm to blame. I think it would be perfectly okay to blame it on Sjogren's if it helps. But sometimes it's just life circumstances, and sometimes we just get really frustrated with what we cannot do because we have so much hopes and dreams and aspirations, and we go through grief about that. And so asking these questions, what can I give myself? Is it that I need validation? Maybe I've just come out of a doctor's appointment that I'm pretty disappointed in, and I'm thinking angry thoughts about healthcare or the clinic, or I am, feeling very defeated. What is it I need in that moment? Validation. I can confidently say that because I've walked through this. I need validation. And so then I say, well, is that something I can give myself? Do I need seriously to connect with somebody else about my need? If quickly I say, well, kind of both, then I say, well, how about if I give myself what I need right now and give myself time to process so that whatever words I use while I'm connecting are non-hurtful, not angry, and non-judgmental, but just communicate to the other person the facts. And, do I need confidence to believe in myself, to believe that I'm deserving of those things I'm maybe needing to connect with somebody else about? Maybe it is sending a letter to our provider expressing how we felt during the appointment. Maybe it is preparing for the next appointment with writing things down and pre-planning what our statements or our responses are going to be. But immediately, the thing that we can do, the thing that I can do is to validate myself. So that self-validation for me can come in many different forms. It can come in my journaling, in a conversation with somebody else who's just listening, a therapy appointment, us telling ourselves truths. Yes, we have this disease. Yes, we do struggle. Yes, managing this is a full-time job. Yes, we do deserve validation.